is Mastering the Hidden Force That Undermines Health and Happiness. And it identifies the fact that people are fat, sick, and miserable because they're eating things that fool the satiety mechanisms in their brain. There are chemicals that are added to food that fool the brain into consistently over-consuming, resulting in obesity and these diseases of dietary excess, diseases that used to be rare, that were actually referred to as the diseases of kings, but now have become ubiquitous. Heart disease, and particularly hypertension, type 2 diabetes, autoimmune diseases, and certain forms of cancer like lymphoma now have become very common as a consequence of eating these chemicals added in our food. And the chemicals include what we call SOS, salt, oil, and sugar. SOS, of course, is the international symbol of danger, and it also stands for salt, oil, and sugar. When you think about it, salt, oil, and sugar aren't actually foods. They're food byproducts. They're chemicals, in essence, that are added to food. And what they do is they stimulate a part of your brain that results in dopamine production. And dopamine is the neurochemical associated with pleasure. So the more dopamine your brain produces, the more you like whatever it is that's causing that stimulation. Now, naturally, there are two behaviors that favor dopamine production, those that are necessary for survival and reproduction. So obviously it's eating and sex. So both of these are normal, natural stimulants of dopamine, but we are pretty creative as human beings, and we figured out that there are ways to artificially stimulate dopamine production besides food and sex, and they included the use of drugs and the addition of these chemicals in our foods that provide hypernormal stimuli. The consequence is when people eat foods with salt, oil, and sugar, they eat more than they would eat if they were just eating whole natural foods, and they eventually become obese and get sick. So it's not surprising that it's very difficult for people to choose not to artificially stimulate dopamine production in their brain. It's just like it's hard for heroin addicts to quit heroin, or it's hard for alcoholics to quit drinking, or smokers to quit smoking, or people drinking caffeine to stop drinking caffeine. It's also hard for people to consciously make a decision not to eat this hypernormal stimulating foods because they're essentially addicts. And some people can do it when they understand it, just like some people can quit smoking or quit drinking on their own. Other people have struggles and need help. The TrueNorth Health Center is one of those places that can help people, and we use medically supervised water-only fasting to do that. It turns out when you use water fasting, which is kind of a normal biological adaptation, the withdrawal effects are greatly minimized. And so within a couple days, people that are addicted to smoking find they don't have any craving for cigarettes, and the same thing's true with people abusing alcohol, drugs, or in this case, chemicals added to their food like salt, oil, and sugar.
Right. I wonder if you could talk a bit about, why people are attracted to certain foods. I mean, some people, they'll think of healthy foods like salads, and they'll look at that, and instead of choosing that, they'll choose something that looks a lot more calorically dense.
Yeah, well, of course, that's exactly right. And one of the points in our book, The Pleasure Trap, is that people will naturally crave the most concentrated foods available. We evolved in an environment of scarcity. So humans that valued high caloric density foods lived to reproduce, and people that liked low density foods, they died. So they didn't pass their genes on. Your ancestors were the ones that got enough to eat, didn't get eaten, pushed everybody else out of the way, and managed to somehow survive in an environment where most people that were born didn't live long enough to reproduce. So only the few that reproduced, that passed on their genes, are your relatives. All the rest we call losers. They didn't make it. So you're naturally designed to crave the most concentrated foods available. And in a natural setting, it works perfectly. You eat as much as you can, whenever you can, of the richest foods available. And if you're really lucky, you live to reproduce. In the modern world, it's a bit of a trap. We call it the pleasure trap, because we have almost unlimited amounts of high concentrated foods and artificially concentrated foods with salt, oil, and sugar. And as a consequence, if we just eat as much as we want of these foods, we become obese, which may be why 2/3 of adults are now overweight or obese. If you're not overweight, you are abnormal, because the majority of people are now developing these diseases of dietary excess. That's what's killing most people. Listen, 30% of people over 20 have high blood pressure, and the majority of people over 65 are hypertensive. It's a leading contributing cause of death and disability. Interestingly enough, the most effective way of treating high blood pressure, according to a study we published in JMPT, where we took 174 consecutive patients and 174 people were able to lower their pressure enough to eliminate the need for medication, is fasting. Water-only fasting, most effective way of resolving high blood pressure in humans. And of course, the problem is you still have to eat a health-promoting diet to sustain the results. And that's a whole foods diet that's free of salt, oil, and sugar.
Right. Yeah. And I guess the, hypertension, one of the biggest things behind that is consuming a high-fat diet, and having foods that have a lot of salt or sugar encourages eating, the excess calories and fat as well.
Yeah, that's that and more. The fact is, for example, too much fat and sugar obviously leads to the pleasure trap, the artificial stimulation of dopamine, overconsumption, obesity. Salt is interesting, although there's no calories in salt itself, and it's a critical and essential nutrient without which, if you don't get enough sodium in your diet, you die. So you're definitely designed to crave it. In fact, you can detect it at exceedingly small quantities, which is why vegetables and things taste good to you, because you can pick up, amongst other things, the sodium concentration. However, by using added salt, we hyper-normal stimulate the system, and a little is good, a lot is great. And so we get very excited about basically anything that you put enough salt, oil, and sugar onto. Now, the problem with salt is it does, as you mentioned, stimulate passive overeating. So if you just eat as much as you want to eat till you feel satisfied or satiated of, say, brown rice, you would eat a certain amount. But the next day, everything else being equal, if you salted that rice up, you'd eat more before you feel satisfied. Now, people say, well, yeah, because it tastes better. Well, yeah, that's what tasting better means, is that it's artificially stimulating more dopamine production. The higher the caloric density, the more you like it. The more you eat, the more you like it. Salt stimulates that those apostatic mechanisms, and as a consequence, you will eat more before you feel satisfied, even of a whole natural food. Now, granted, it's much easier to regulate quantity intake in a whole natural food with normal feedback than in an artificially concentrated food, something like, say, bread or crackers. You've taken a grain that's normally about 500 calories per serving, ground it into a flour, increased its caloric density. Now it's about 1,500 calories a pound in its final form. The consequences, if you eat, say, for example, you just eat potatoes, as much as you can eat. You fill the human stomach with potatoes, about 500-600 calories. You fill the human stomach with bread, it's about 1,600 calories, about 3 times the caloric density. It's much easier to get fat eating bread than just eating potato, for example. And now that's before you turn the bread into a butter boat and, spread coagulated cow pus all over it in the form of butter and stuff. So you can increase caloric density to the point with something like pizza, where it's almost superhuman. In other words, the amount of caloric density is so high, it dramatically exceeds what you would normally find, from most whole natural foods. And it may be why people are eating so much of it and getting so fat and sick.
Yeah, and I guess the odd paradox is that we're overnourished, but we're also malnourished. And I wonder if you could talk a bit about some kind of the specific satiety signals, where they start and what they naturally respond to.
Yeah, well, there's a number of different satiety circuits. Some of them respond to fiber. So when you eat a highly processed food where you've removed the fiber, obviously you can eat more before those stretch receptors would kick in. There's also satiety mechanisms in the brain. In the book, we talk about Yao circuits. You're overweight, eat less. So you reach a point where you start getting feedback that the body's reached satiety. But you're also designed to eat as much as you can when the opportunity arises. And so, Dr. Lyle talks about the cram circuits and how you're designed when there's an opportunity to feast to do so. The problem is now we're feasting breakfast, lunch, and dinner every day of the year. It's no longer limited by seasonal variation or the success of acquiring concentrated food sources. So we're living in a very unnatural environment, unlike the environment of scarcity that we're designed for. We're living in an environment of abundance, which no human ever, had consistently. And as a consequence, we're suffering the consequences of that. And what we do at the TrueNorth Health Center is help undo the consequences through the use of education about the value of a whole plant food diet, exercise and sleep, and through medically supervised water-only fasting, which just kind of works like it does to reboot a corrupted hard drive on a computer. You know, things that aren't working very well, but you turn it off, you turn it on, you don't know exactly why, but things start working again. Same thing with fasting. You don't have to know exactly everything that went wrong, but you shut the system down, reboot the system with fasting, get people on a whole food, plant-based diet, and now all of a sudden the body starts doing what it does best, and that's heal itself.
Right. I wonder if you could talk a little bit about what effects the gut microbiota might have as well in the obesity epidemic or our attraction to certain food.
Well, you know, it's interesting. They say you have about 5 pounds of bacteria just living in your intestinal tract, maybe 1,000 different strains. And these bacteria are an important part of your immune system. They keep each other and outside agents in check. Which strains you grow in your gut and what they give off can be profoundly influenced. For example, when you think about 5 pounds of creatures living in your gut, they're breathing, they're eating, they're drinking, and they're defecating in you right now. So you got 5 pounds of bacteria pooing in you as we speak. And what they poo in you could be fertilizer, things like vitamin K and stuff, or it could be toxic waste like TMA, which becomes trimethylamine oxidase when it's processed by the liver and is thought to damage the animal lining of the vessels and may be associated with cancer and heart disease and all kinds of other problems, which may be why the more animal foods people eat, the higher their risk factors are for premature death and disability, in part because the effect of that they may be having on the microbiome that live in your intestinal tract. We also do things like take antibiotics, which can have a profound effect on the bacteria that live in the gut, and then wipe out not only what you call the bad guys, but also the good guys, and you can disrupt the whole pattern with antibiotic use. Also things like diet, like for example, what do you think salt was used for in earlier times? It was a preservative. So if you salt up animal food or something, it acts as a preservative, it kills off bacteria and keeps bacteria from growing. Well, if you eat a bunch of salt, what do you think it's doing to the bacteria that live in your intestinal tract?
Right.
You know, it is a powerful chemical influence. And so people eating salty diets are undoubtedly going to have different microflora than people that eat unsalty diets. People that eat animal-based diets have different microflora and different waste products coming from their flora than people that are eating a plant-based diet. Mm-hmm. And what we believe is that a whole plant diet that's free of salt and sugar favors normalized gut microbiome. If your microbiome doesn't have enough soluble fiber to eat, one of the things it can do is break down your digestive system, the mucosal lining of your intestinal tract, which may be exactly what's going on in some autoimmune diseases. Is literally these organisms are trying to survive, and you may not have exactly the right balance of organisms, often because of well-meaning but misguided medical treatment. And as a consequence, you have, you know, a trillion cells not functioning properly in your body. You know, if you take the human being that say weighs 150 pounds and divide it into human cells and non-human cells, they say there's more non-human cells than human cells. You make two piles. So your relationship with these organisms is, you know, whether it's viruses, bacteria, protozoa, et cetera, very, very important. Mm-hmm. And it's profoundly influenced by what you feed them. And so that's where the thing is, people don't understand how critical diet is. And they say, well, it's just a little bit of this, a little bit of that. Well, that's true. A little bit of this and a little bit of that may not, for example, make you obese, but it can have a profound effect on this disrupted microbiome in the gut. And we are, you know, the TrueNorth Health Foundation is a 501c3 nonprofit research facility, essentially, that we're doing primary research on the role that diet and fasting play. And we have actually completed a study with Luigi Fontana at Washington University looking at exactly this issue. I believe it's the first study looking at changes in microbiome that occur with long-term water-only fasting. Okay. And we have, you know, we're involved in a number of other studies currently. We're looking at a study with the Mayo Clinic on the primary prevention of stroke using fasting and diet, and what effect it has on not just the microbiome, but also on other biomarkers associated with stroke risk. We're looking at, we've completed a study on taste neuroadaptation, the changes that happen to the palate before and after fasting. You know, before fasting, a lot of times people find healthy foods kind of plain or even disgusting. They can't stand fruits or vegetables or other, you know, what they call tasteless swill. Mm-hmm. And then after fasting, that same food actually begins to become much more appealing. And apparently it's a change in how actually people perceive perceived food, the sensitivities improve. So something like Swiss chard actually tastes very salty,
Right.
whereas a person that hasn't been through fasting may not find it have much flavor unless they add all kinds of stuff to it.
Mm-hmm.
People also need to remember a lot of the foods they eat and love don't taste good unless you add these chemicals to it. For example, cheese, or I call it coagulated cow pus, because that's essentially what it is, since the FDA allows up to 750,000 pus cells per cc. But if you take the salt out of it, people find it kind of chewy, disgusting, unappealing food. Because really what they like about it is the salt
Mm-hmm.
and the fat. Other foods like meat, without the sauces and the other stuff is really, far less appealing to people, because you're basically using food as a carrier agent to get these chemicals to your palate. That's essentially what a modern chef is. Somebody that's learned to use these chemicals and use, quote, food as a carrier agent to deliver these chemicals to the palate of the unsuspecting gourmand.
Right. It's interesting. I'm a cook, and I was in India, and I learned from this one wonderful man. He was Nepalese, and he told me traditionally, like, the reason that you have the dal and the other vegetables with your rice is to get you to eat the rice. It's pretty much the idea. So I wonder if we could talk a little bit about therapeutic fasting. I know that I believe TrueNorth does water fasting and juice fasting, as well as just putting people on the whole food plant-based SOS-free diet.
Well, we design a program that's designed to meet the individual needs of the patient. Not everybody can do water-only fasting.
Yeah.
Some people are better served with a modified program that includes 600 calories of vegetable-based juices and broths.
Mm-hmm.
Some people aren't good candidates for water or fasting, juice fasting, and so we'll use a healthy diet of whole plant foods that's free of salt, oil, and sugar. And sometimes it's a combination. You start off with a diet, you go to juice diets, and then you can go to water-only fasting if it's appropriate. But we do specialize in medically supervised water-only fasting. We fast patients from 5 to 40 days. We've been doing this for 35 years. We've had over 20,000 people successfully go through this water-only fasting process. And so far, we've been fortunate that everybody that's walked in to do fasting has been able to walk out. So we've got a very good safety record in screening patients appropriately, monitoring them carefully. Each of our patients is seen by one of our staff doctors twice a day. They live at our facility. While they're here, we go through intense educational classes with them, and they're carefully monitored. And then when they're done, we prepare recommendations for them, hopefully to stick to when they go home, so they can get a good long-term outcome and make us look good.
Mm-hmm. So what I find interesting is, people are going on this ketogenic diet in an effort to get into ketosis. But
yeah.
what I know, like with the water fasting, could you describe the process that the body goes into and then before it gets to ketosis, and what the actual difference is when you do water supervised fast than doing this ketogenic diet?
So they call them fasting mimicking diets because they try to mimic some of the effects of fasting. And when you go on a water-only fast, the body utilizes its glycogen reserves, and after a day or two, you've depleted your glycogen reserves, but you still have a need for glucose, and your biggest burner of glucose is your brain.
Yeah.
But the human brain is rather unique because it changes fuels from burning glucose to burning a byproduct of fat metabolism called ketones, more specifically beta-hydroxybutyric acid. And so when it does that, the body shuts down its hunger mechanisms, turns those way down. And so after a couple of days of fasting, once you're in ketosis, there's really not any hunger. So these patients fasting with us, they go to cooking classes, they go down in the dining room, even though they're not eating, and they really don't seem to have too much concern about that because they're not actually hungry. Well, what the folks doing fasting and modified diets have done is they've kind of tried to fool the system basically by putting people on a fat-only diet. Like in fasting, there's no carbohydrate coming in. So the glycogen reserves get burnt and hunger gets shut down. So you can put people on a diet of animal foods and fatty foods, and they won't be that hungry, and so they'll use it for weight loss. Now, it's not actually been shown to be an effective long-term strategy, because the problem with putting people on a high-fat, high-protein diet is it makes them sick.
Right.
And so, their hunger may be blunted, but then they develop all the same consequences anybody on a high-fat, high-protein diet does.
Mm-hmm.
And, that's a problem. So even the people advocating those programs generally say, well, they just want to do it for a short time, just a way to fool the brain to try to lose a little bit of weight. Now, a healthier way to lose that weight would be to go on a whole plant food diet free of salt, oil, and sugar.
Mm-hmm.
And males will lose 3 pounds a week and females 2 pounds a week, basically until they reach optimum weight. And one of the reasons it's easier to lose weight on a diet of whole plant foods is because you get rid of a lot of the cravings that come from your blood sugars being bounced around by eating sugar, which causes insulin to flush in there, and then it drops your carbohydrates. And most carbohydrates eaten by people, about 86% of it, is not whole plant starches. It's refined carbohydrates. It's flour, sugar, white rice, etc., sweeteners, etc. And so as a consequence, when people think about carbohydrates, they think about refined carbohydrates, because that's essentially what most carbohydrates are. They're not thinking about potatoes and carrots and vegetables. They think about breads and flours and cookies and crackers and sugar.
Right.
So we all agree, the pedo, the keto, the whatever, and us agree that people should get rid of refined carbohydrates from their diets entirely.
Right.
So, and once you do that, you don't have to go on a diet that's just animal fat and protein, or oil and protein, in order to lose weight. You can do that successfully on a whole plant food diet. Now, do people lose weight when they eat meat and no carbohydrate? Yeah, for a while they'll lose some weight until eventually they get the problems. Their gallbladder goes bad, or they start getting cancer, or heart disease, or some other problem, and become a mess. And unfortunately, in some conditions, particularly conditions like certain types of cancer, eating a meat and high-fat, high-protein diet is like throwing gasoline on the fire of inflammation. So it's strongly counterproductive. We get a lot of the calls from people that have, desperately gone onto these diets thinking they're doing themselves a favor, and basically destroy their health around the consequences of it. So I don't recommend those diets for any reason, weight loss or other. But it is true, they do mimic one of the effects of fasting. However, on fasting, it's completely different. You're in a biological adapted state to no caloric intake. You're burning by the end of the second week of fasting, 90% of calories are thought to derive from your internal fat stores. It's important when you're fasting to rest. If you stay too active, you have to develop more glucose utilization for your brain and your muscles. That would need to come from protein, which you would get through a process called gluconeogenesis. We don't want you breaking down your vital reserves. That's why when we fast patients, we rest them, so that most of their energy can come from fat. And you can fast so long as there's adequate fat reserves generating that source of calories.
Right. And I guess one of the interesting things I was comparing these two is, when people go on this ketogenic diet, they're thinking that they're utilizing their fat stores, but they're continuously introducing fat into their body as well. Whereas when you do water fasting, it seems that you're not introducing anything. So your body can utilize what fat stores are there and help with the detoxification. With the fasting mechanisms, I wonder if we could just touch on them briefly, and if you could talk about how they're beneficial. So what first with weight loss and how that can, that's kind of an obvious one, but if you could talk
about. Well, I have to say, we don't usually use fasting for weight loss per se. If your only goal is weight loss, if you're otherwise healthy, there's no other issues to deal with, you will lose about the same amount of weight overall, adopting a low density, high nutrition density, low caloric density diet. So eating fruits and salads and steamed vegetables and exercising and being active. If you're a female, you're going to lose about 2 pounds a week. If you're a male, you're going to lose about 3 pounds a week, maybe a little more at first as you're going through diuresis and such. And, that's 100 to 150 pounds a year rate. I'm not sure how fast people think they're supposed to be losing weight. It is true, when you fast, average weight loss is a pound a day. Obviously, if you're not eating, you're gonna have to burn fat stores, and that's fine. It's certainly a welcome side effect for many people. But most of the time, when we're fasting, it's to clear the palate, it's to overcome the health condition, it's to give the body a chance to increase autophagy, to make these biochemical changes associated with fasting. It's not necessarily because we think that the best way to lose weight is to go on a fast. Right. For some people, it would be strongly contraindicated, because unless you follow a fast with a health-promoting dietary regime, unless you rest while you fast, unless you do this properly, you can create more trouble than you solve. So weight loss, although it's certainly an attractive aspect of fasting, it's really not one of the primary motivations from my viewpoint, because we can't achieve that weight loss without people ever having to fast at all. However, we do recommend intermittent fasting, which is limiting the feeding window for all people. It turns out, if you say you eat breakfast at 9 in the morning and you don't eat after dinner at 5 or 6 in the evening, there's a period of 14 to 16 hours a day where you're fasting, just by not eating 3 hours or more before you go to sleep. Well, that may have benefit for many people. People sleep better and sounder. They aren't having the disruption that happens trying to shove stuff into them right before they go to sleep. And that period of fasting between dinner and breakfast, which you would break with breakfast in the morning, actually, according to Walter Longo and others, publishing in Journal of Metabolism in 2015, may be inducing some of these beneficial aspects of fasting, although to a smaller degree, it's a shorter period of time, but cumulatively they may induce changes that are thought to be associated with slowing the aging process and rejuvenation and other beneficial effects. So we do believe that people can safely intermittent fast, that is, limit their feeding window to maybe it's 8, 10, or 12 hours, depending on who the person is and what their needs are, allowing them to have a 12, 14, or even 16-hour fast every single day. And so cumulatively, that may turn out to help prevent overeating, help prevent eating right before they go to sleep, which may improve sleep quality and may improve their overall health. So we like intermittent fasting for everybody every day, but long-term water-only fasting we believe should be done under medical supervision in a controlled setting. The important things with water fasting is, one, make sure that the patient is an appropriate candidate for fasting. Not everybody is. If you go on our website, we have information that talks about the people that maybe wouldn't do well with fasting or that would be contraindicated in. And that includes all patients that can't be stabilized off medication. So it's very important to understand medications act very differently in the fasting state than the fed state. And it would be very dangerous to be taking many different types of medications while you're in a fasting state. So first, patients have to be able to be stabilized, but they have conditions that will respond to this state and not be contraindicated. And that you establish baseline data with a history exam and laboratory data. And the reason you need that is you need to tell the difference later between something that can look scary, but is a good thing, body generating an acute response to get well, called a healing crisis, or a bad thing, like electrolyte imbalances or cardiac instability, et cetera, to tell the difference between what looks scary but is good and what looks scary and is bad. What's really useful is knowing the patient's history, having daily monitoring data, and laboratory data, so you can compare and contrast. You can tell what their electrolytes are doing, because the same symptoms that can be associated with a healing crisis can also be associated with deprivation or depletion or some other problem. You need a little bit of help to differentiate that, even for those of us that have fasted thousands and thousands of people. For people that are not used to fasting patients, it can be really terrifying, because when you see things that in the fed state would be very bad, but actually are a normal process. But that's where even the doctors that train with us, we have about 30 physicians a year that come in as part of their medical training, or after they're done with medical school, they'll come in and get certified in fasting supervision, because they want to learn how to do something really novel, almost unheard of in medicine, and that is get people well. Under medical care, for example, the people we treat with high blood pressure, they will be told that they need to be on drugs for the rest of their life. The doctor will assure them if they do exactly what they're told, they'll never get well. They'll have hypertension until they die from it, because they'll never, ever recover. That's why they know they'll be on drugs for the rest of their life, because drugs, of course, have nothing to do with getting rid of the cause of hypertension. They're just trying to artificially regulate blood pressure to slightly reduce the risk of stroke. If you have type 2 diabetes, you'll be told the same thing. Oh, you're on drugs the rest of your life. You never get well, because they're not doing anything to deal with the cause of the insulin resistance, which would require diet and lifestyle modification. If you have lymphoma, you'll be told diet has nothing to do with your condition, and fasting is criminal quackery. And so you just have to take this drugs, even though we know it doesn't necessarily reduce all-cause mortality, it doesn't necessarily improve the quality of your life, but it's the best we've got, so that's just what you have to do. Doctors come and train with us. They learn to see people get well.
Mhm.
And, now not everything gets well with fasting and diet, but we take the people that have the conditions we expect to have a good response. People that have conditions that wouldn't respond, that's what the point. We try to differentiate those and have them do something more appropriate for them.
Great. So I wonder, on that note, like I was trying to do a comparison. I did some research a little while ago on the Gerson therapy. You probably know of it. It's a juice fasting, and then with the water fasting, and
So
with a
it's actually,
diet like, I'm sorry.
yeah, the Gerson therapy is very interesting because it's kind of the opposite philosophical side of the coin. So
Mhm.
what they're saying is you have a deficiency of micronutrients or whatever, and so we're going to give you 16 very nutritious juices a day, stop all the greasy, fatty, slimy, dead, decaying flesh and highly processed foods, and try to give the body a chance to be well nourished and heal itself. So that's one kind of philosophical approach. And I have no problem with the idea of trying to give people healthy foods and get rid of garbage. Water fasting is operating on the premise that many people are actually sick as a consequence of dietary excess. It's not actually deficiency that's driving the boat. And
Mhm.
so fasting is a way of undoing some of the consequences of excess. There's probably some truth to both ways of thinking. One of the things we do before fasting is get people to eat a whole plant food SOS-free diet so they're not depleted going into the fast, so they have the reserves to carry through the process. But ironically, many people that are not well nourished are not well nourished not because they're not eating enough, it's because they're not absorbing enough. And fasting, albeit maybe it's briefer in those patients, may be what it takes to get them to where now they can absorb the food they're eating, you can build them up and then be in a position to do a longer fast if it's appropriate sometime in the future.
Right. And I guess that, so what I was looking at was when you were talking about the healing reaction. So this is something that can happen, and if you're able to diagnose and see if this is something good or bad when somebody goes through a fast. And I was trying to determine, like with the Gerson therapy, they recommend these enemas because they're saying the liver can be overloaded with but at the same time you're drinking all of these juices and introducing all of this stuff into your body. But with the water fasting, you go into ketosis, your metabolism slows down. There's sort of a regulated process. But then if you're saying eating a diet like the whole food plant-based kind of a Dr. McDougall type of diet, it's also kind of a regulated detoxification, but might be a bit slower than a water fast. I mean, is that?
Well, it's all much slower than water fasting. Water fasting is dramatic. That's one of the great things about water fasting is it dramatically speeds up this process. You can be on a healthy diet for weeks or months before you'll see changes in a few days with water fasting. But that's also one of the problems with water fasting. It's very intense.
Right.
It can be an intense and miserable process unless you prepare for it properly and you conduct it properly.
Mm-hmm.
And so, that's why Dr. McDougall calls us the punishment. So he will refer us patients with an apology, and he'll say, look, your blood pressure is still too high, whatever. I'm so sorry to do this to you, but you have to go over there and, go through their process, because he knows that in some cases, that can be a stricter version can be effective at resolving that resistant hypertension or whatever the condition is. Many people, all they have to do is adopt a whole plant food diet. They do great.
Right.
But some people, despite adopting whole plant food diets, still struggle with their issues, and that's where oftentimes they're referred to the TrueNorth Health Center. They call us TrueNorth Health Center the last resort,
Mm-hmm.
because we're, sometimes the last step in the process. But that's okay, because I don't think that fasting is certainly for everybody, but for people that are diligently applying diet and lifestyle principles but struggling with the rapidity with which their body's healing itself, this can be a way of dramatically speeding it up. Now, this idea that the body doesn't know what it's doing, and it's dangerous to fast because you're going to too rapidly detoxify, is usually promoted by people that will also tell you that it's dangerous unless you take their proprietary products. So if you take their pills and potions, then it's perfectly safe.
Right.
Because they've designed this thing to overcome the limiting factors, the P1, P2 pathways, whatever it is they're going to be arguing. That's not been my experience. My experience is that this is a biological adaptation that works really well. The body does a good job of controlling and regulating the rapidity with which it detoxifies. And I'm not saying that complications can't ensue. That's why we monitor people. But generally, the body's well equipped to fast people. You don't need to take pills and potions in order to allow the body to successfully fast. Appropriate candidates that are screened properly, monitored appropriately, and rested generally do very well, as we've been able to demonstrate. And we've published a fasting safety study where we took 5 years of consecutive patients, and you can go to our website. In fact, the foundation has a website at fasting.org, which is a fasting compendium website, and all the things that I'm referring to are located on that site. You can download them freely. They're all the articles and our work, other people's work, everything you'd want to know about fasting ends up ultimately getting located on fasting.org.
Okay.
And so, for people that are interested, they can look into the facts and convince themselves about the safety of fasting when it's used appropriately.
So before we go on to one of your case studies that I'd like to dig into regarding cancer, I just want to touch again on like the mechanisms that occur during fasting that are beneficial. So that was like when I mentioned the weight loss, natriuresis, detoxification, enzymatic induction, reducing insulin resistance, and gut leakage. I wonder if you could just touch briefly on some of those.
Well, this idea of toxicity has been long established in the natural hygiene movement in naturopathy and nature cure. And it turns out it's true that people have, if you do a fat biopsy and you analyze it, you'll find hundreds of different chemicals accumulating in the cells of humans, dioxin, PCB residues, heavy metal contaminants, byproducts from exposure. Most of it gets there because people choose to eat animal foods, which biologically concentrate poisons from their environment. Animal foods can have 2 to 1,000 times the concentration of many of these chemicals as, say, plant-based foods. And so people eating a lot of greasy, fatty, slimy, dead, decaying flesh and coagulated cow pus and all these eggs and products tend to build up a lot of these materials in their cells. And it's thought that everybody has different levels of thresholds, but different chemicals at different thresholds can interfere with cellular function and be associated with aging and premature death and disease. And so one of the things that's thought to happen in fasting is rapid mobilization of many of these intermediary products of metabolism and toxic products, and that are processed and eliminated. Interestingly enough, though, almost all this detoxification occurs when the blood is purified by the kidneys and is eliminated in the urine. It's not coming out the bowels. And this idea that you're going to do a bowel laundry process and flush people's bowels and cause a lot of detoxification is really a bit of an old wives' tale. The most toxicity isn't even coming out the bowels. That's the stuff that never even got in the body. Most of your detoxification is actually will show up in the urine as the kidneys process the blood. So detoxification definitely occurs in fasting. Natriuresis, the selective elimination of sodium, happens, which is why blood volumes drop very rapidly. Blood pressure corrects. The non-healing wounds start to heal. The respiratory distress, the congestive heart failure starts to unwind. And there's many mechanisms. In fact, the articles we have on our website talk a lot about these different mechanisms in general. Some of them have been well established. Some of them are more speculative. It's interesting, though, if you look at the literature on exercise, there's certain chemicals that have been associated with exercise that are thought to be helpful, like sodium-derived neurotrophic factor, brain-derived neurotrophic factor, BDNF. Brain-derived neurotrophic factor goes up in patients that exercise. And for example, rats in a cage, if everything is equal, but you give one rat a wheel that it can run on, those rats that can exercise will, and they'll have much higher BDNF levels, and that's associated with a greatly reduced risk of Alzheimer's disease. And so it's thought that exercise may help reduce the risk of dementia and Alzheimer's disease in rats because of this, amongst other things, one of the things is higher brain-derived neurotrophic factor, which is thought to be protective. Well, what's interesting is not only does BDNF go up in exercise, but it also goes up in fasting. In fact, if you look at all the chemicals associated with health promotion of exercise, it's very common to find that those are the same neurochemical changes that occur with fasting. So you might ask yourself, how could something vigorous like exercise do the same thing to the body that something passive like fasting does? And I believe the answer to that may be that exercise helps undo the consequences of dietary excess. And fasting helps undo the consequences of dietary excess. And when you undo the consequences of dietary excess, many of these chemicals associated with being healthier normalize.
Mm-hmm.
And so I think that fasting and exercise are both helping normalize internal physiology. And that we're going to find as we learn more about this, that may be why if you take rats, for example, and do periodic fasting, you double their lifespan.
Mm-hmm.
In fact, if you ask the folks at the Life Extension Institutes that are actually doing research, places like the Buck Institute, they'll tell you the only thing that's actually been shown to extend life consistently is calorie restriction and fasting.
Right.
Because it's dietary excess that may be actually causing people to age prematurely. It may not even be that fasting is introducing any magic property as much as undoing the consequences of dietary excess, which is one of the themes of our book, The Pleasure Trap, is that this dietary excess is an inevitable consequence of artificially stimulating dopamine production from eating these chemicals that are smeared all over the food.
Right. I know in Chinese medicine, they have, it's taught that you have a certain amount, like you're born with like this life expectancy, but what you do in your life can affect, like you can basically
you can shorten it.
Shorten it, yeah. So
yeah.
if you're doing,
well, that's important because you know of the 109 billion humans that have been born on the planet and the 7.6 billion that are still alive today, there's only been well-documented evidence that 5 people have lived past 117.
mm-hmm.
So your odds of living past 117 are currently about 1 in 20 billion. So its chances are better that you're going to die somewhat before that. The question isn't, are you going to die? You're going to die. The question is, how long are you going to live until you die? And how well are you going to live in the time you have left? The average person spends 9.6 years in ill health and 17 years or in debility and 17 years in ill health. You can dramatically reduce the risk that you're going to find yourself unable to talk or move, lying in some nursing home bed, waiting for people to change your diaper for the last years of your life, by not having the heart attack, not having the stroke, not developing the disease of dietary excess. The promise of healthful living isn't that you're going to live forever, because you won't. The promise is that you're going to dramatically reduce the likelihood that you're going to be debilitated and dependent on others in the final years of life. You can make the last 20 years of your life the happiest and healthiest years of your life, or you can make them, miserable. And a lot of that will depend on the choices you make about what you put in your mouth today.
I know that's actually the one thing that people are worried about, because they do want to live like a good life, but people are worried about getting old, and for those reasons that they don't want to be.
Well, what they're worried about is getting debilitated, and they should worry about that.
Yeah.
But what you shouldn't have to worry about aging. If you age well, there are many studies have shown people in the final decades of life can find the highest degrees of life satisfaction if they preserve their health.
Mm-hmm.
But it can be very difficult to preserve your health if you're busy compromising your health with short-term pleasure-seeking, self-indulgent behavior.
Right, and that's a physiological thing. So I want to talk about the case study you had, and it was published in the British Medical Journal about a woman. I believe she was 42 years old when she came to you, and she had follicular lymphoma. So from what I know about cancer, there has to be an exposure to a carcinogen, but cancer, this metabolically, it's has to thrive in a hypoxic environment, and something happens to basically mutate the mitochondria in the cells.
Well, there's a lot of debate about what actually is the cause of cancer. If you look at Seyfried's work, he argues that cancer is a metabolic disease, and not necessarily a mutation, which may be why current medical treatment is so fabulously ineffective at actually managing cancer. So I don't know that I know the answer to what actual is the mechanisms by which people get cancer. I think that's an active area of debate. It's fascinating. It's interesting. The good news is it doesn't matter what the cause of cancer is, because we know the cure for cancer, and the cure for cancer is prevention.
Right.
And so preventing cancer, whether it be avoiding antigens, supporting healthy living, these are the things that we need to be focused on, is what can we do to live healthy so we don't get cancer. Once we get cancer, the principles remain the same. The same things you do to try to avoid getting cancer, you need to be doing if you have cancer, and try to support the body's ability to try to manage cancer. I'm not a real big fan of the concept of cure. You can't, for example, cure obesity.
Mm-hmm.
You can lose weight and keep it off, but if you go back to eating greasy, fatty, slimy, dead, decaying flesh and processed foods, you're going to get fat again.
Right.
You can't cure high blood pressure. We took 174 people, and 174 people achieved pressure low enough to eliminate meds, but if you go back to the salty processed foods, they're going to get high blood pressure back because they're not cured, they're managed. And the same thing's with autoimmune disease, and I believe the same thing is true with cancer, that you can try to manage it and keep people to hopefully live their full life and be healthy, but I don't think you really cure it, because if you go back to doing the things that cause it, it's likely to flower again. And that's why I think conventional medical treatment is so misguided, because they're busy trying to kill cancer cells without actually trying to support the underlying immunological function necessary to keep cancer. I believe that everybody's forming cancers in their body, and the body's immune system is constantly in a battle to try to fight it off. And if you fight it off faster than the cells double, then you stay healthy. And as soon as things are doubling faster than you can keep track of them, eventually it becomes palpable and observable, and then eventually you succumb. So I don't like the concept of cure. I'm not that interested in even thinking about it in that regard. But what we do know is that health is a result of healthful living. And when we teach people to live healthfully, they can often have remarkably impressive results, including in the case of this patient with lymphoma that presented to us at age 42 with a 2-year history of progressive development. She had stage 3 follicular lymphoma. It had been well established with excisional biopsy. She had palpable lesions, externally palpable lesions, both in her upper and lower part of her body, and had been told by her doctor that the conventional treatment wasn't really that effective. They deferred and delayed it for a couple of years, and then they finally felt it had gotten so bad that she would have to submit to chemotherapy. She asked him about, what about alternatives? He said there were no alternatives that were effective. She asked him specifically about a whole plant food diet. He said no, diet didn't matter when it came to lymphoma, and she could eat whatever she wanted. There was no reason to be restricting her diet. She asked about fasting. He told her that was criminal quackery. It's going to be ineffective. Eventually, she was referred to an oncologist at the medical school near us, who confirmed the diagnosis, recommended a series of chemotherapeutic treatments. She asked him about alternatives. He assured her that diet wasn't related to this particular cancer, and that he didn't think fasting was relevant to the management of the condition. So given that she had such strong medical encouragement, she decided to come to the TrueNorth Health Center. She underwent 21 days of water-only fasting, during which time her tumors disappeared. So after 3 weeks of fasting, we could no longer find and feel any of these tumors that had been there. She refed for 10 days, went back to the oncologist with some coaching, and he was very impressed when he couldn't find any tumors on her. Told her that she asked about a follow-up CT scan at our request. He said no, that wouldn't be necessary because she was better now. She said that she wanted to objectify it because we'd asked her to please get follow-up objectives so we could publish her case report. He didn't think that was a very good idea because she was better and wouldn't need that. And so anyway, she persisted, asked him how he could be certain there wasn't cancer lurking just beneath the surface. He admitted reluctantly to do follow-up scans. He confirmed that she had had a dramatic improvement in her condition, but because she was still neutropenic, recommended that they go ahead with some chemotherapy. She refused the chemotherapy, continued with the plant-based diet, and after a few months, fortunately, her white counts normalized, and he acknowledged that she wouldn't be needing any other treatment. We followed her for a year. She continued to eat a whole plant food, SOS-free diet, and at a year, she had a year follow-up confirmation of her results, so we decided to go ahead and try to publish a case report, which we did. We submitted it to the British Medical Journal, which at first they gave us some feedback that from one of the reviewers that they felt that we had dramatically overstated the case, because we had suggested that we felt that this case suggested that further research should be done looking at the role that fasting in a whole plant food diet might have in managing lymphoma. And he said that, of course, there's about 10% of lymphoma patients that go into spontaneous remission. So it doesn't necessarily mean, even though this woman had progressive problems for 2 years, she completely resolved it in 3 weeks. It didn't prove that it was because of fasting and diet, but that if we would follow this patient long-term, that would be more impressive, because even the patients that spontaneously remit tend to recur. So, and we softened our language a little bit, and they did, acknowledging the fact that a percentage of people go through spontaneous remission. And they did eventually agree to publish this in British Medical Journal case reports. And And 4 years ago, this article appeared. And then 3 years later, we continued to follow this patient. I told her that she had to stick strictly to the diet or it could be fatal because I'd track her down and kill her. So she did stick to the diet, and she's a wonderful woman. And at 3 years, we had full body CT. We, did objective follow-up. Everybody agreed that she was in full remission. And now I've actually got another year of follow-up. She continues to do well as she continues to follow the program. We actually did another fast just preventatively after 3 years. And so we submitted this follow-up paper. At first, they were reluctant. One of the reviewers felt that it was a little too radical a recommendation, but ultimately they did decide to publish the follow-up as well. So now there's 2 papers in British Medical Journal Case Reports, the original case report and a 3-year follow-up. And for people that are interested, they can read the articles and the whole protocol by going to fasting.org and looking at that article that's published there, along with all the others. We've had many case reports and a number of studies that are published there. We also have a website, health-promoting.com, where we have a lot of what we call navigator stories, where people tell their experience that aren't necessarily published in peer-reviewed journals, but people expressing what their experience has been. So they can look at that information. The bottom line is that fasting is an effective tool in conjunction with a whole plant food diet, helping people improve their overall health. And in many cases, it's surprising how well the body's able to heal itself.
I wonder, as a closing on that, if you've had other people who have come to you with sort of terminal forms of cancer or severe forms of cancer, other patients, and if it would be kind of something to consider fasting plus the diet instead of just a whole food plant-based diet for somebody who's in such a sick state.
Yeah, so I think that there are some people that are no longer good candidates for the vigorous process of fasting if they allow the condition to get too far progressed. But we're actually in the process of doing studies right now, looking at trying to come up with non-invasive biological markers that predict who's going to respond well, how long do they have to fast, when will they have responded. And that's part of the research that we're doing at the TrueNorth Health Foundation, is learning how to use this tool in the safest and most effective way possible. Up till now, that's been impossible because nobody could get a permission to do long-term water fasting because Human Subjects Committee would turn them down because they felt it was too dangerous. Now that we've published safety data, it's going to open up the market for us and others that are interested in exploring this very powerful and natural. So there's nothing that I've seen in the 35 years I've been in practice that even closely approximates the power of doing nothing intelligently, which is essentially what fasting is. It's remarkable. I have to admit, even now, 35 years later, every week we have our grand rounds meeting. We review all of our active patients, and I'm constantly going, oh my gosh, it worked again. Sometimes it's disturbing because the people that aren't even supposed to get well are getting well, I think just to annoy me because, I'm pretty confident this is not a condition they'll respond, and for some reason we've accepted the patient, and then they go ahead and get well, which makes us broaden our view of, what's possible. So not everybody's a candidate for fasting. Certainly not everything gets well. But there's enough stuff that does get well that I think that fasting should be considered, at least, in the toolbox of all doctors that are looking at patients that are dealing with chronic problems. And, it's not just high blood pressure and diabetes and autoimmune diseases, but certainly in the case of lymphoma, we definitely are seeing, we continue to manage patients, and we're optimistic that it may have a role. If we can publish enough case reports, we may be able to eventually convince the powers that be to actually engage in a clinical trial. And I'll be very excited to compare our approach to the conventional, drugum approach and see what happens with long-term outcome. I'm quite optimistic we're going to find that healthful living is going to beat conventional medical intervention, at least in this particular condition. Right.
Yeah. It's one of the things that I find interesting with all of the research that's coming together with especially the diet, the food that you put into your body. And what happens is, I want to go back to what you said about like rebooting a computer and you get something in there. It almost seems like, and in terms of cancer too, that when you put food in your body, you're bringing in new information. You're sending certain signals to your body. And some of them are saying, more growth, or survive with less oxygen, or adapt to a constant state of inflammation. and your body tries to do that, but of course it's not well adjusted. It's not meant to do that, and you get these conditions. But I don't know if does that seem sort of the case with all the research and stuff that you have done?
Well, I think that unfortunately most of the research that's been done on fasting up till now has been on animal models.
Mm-hmm.
And it's very difficult to extrapolate animal models to humans. Like, for example, rats make their own vitamin C.
Mm-hmm.
So, they used to do research on rats, and of course they got really confusing results because it turns out rats don't need to eat vitamin C because they can make it from carbohydrate. Rats don't fast. Their brain doesn't convert to burning ketones.
Mm-hmm.
That's why rats can only live a few days and then they die. Okay?
Mm-hmm.
And so trying to extrapolate interspecies research can be problematic. So I think that the animal research is important because it helps us look for mechanisms and all that. I think actually what we need is more human subjects research, which is exactly what we're trying to do through the TrueNorth Health Foundation. And I think until we actually get data, and I'm really reluctant to start speculating about what it is that's actually going on and why we're seeing the results. We know we're seeing the clinical results. That's what our research to date has shown, that if you do this, there seems to be an association with, the body making a healing response. Why it's making the healing response, though, I think is still quite speculative.
Okay.
So I don't want to talk before we actually get the data that will support it. But what I can say is that we can do it safely, that it's a natural biological adaptation, that there are many conditions, particularly high blood pressure, diabetes, autoimmune disease, lymphoma, that we see consistent clinical outcomes in, and we're publishing clinical outcome data. And as far as the science, I think it's Walter Longo and Luigi Fontana and others that are really getting into the weeds with the science that will hopefully help us more definitively answer how is it that fasting is working to get these people well. And so we're cooperating with both of those researchers and others because we're kind of the laboratory where patients can actually come and do this. None of the current researchers have the kind of opportunity we have at the TrueNorth Health Center, where people do long-term water-only fasting in a controlled setting.
Right.
And we have over 1,000 people who are admitting a year doing that. So we're a really good location for people that are interested in asking these questions. But as far as the specific science, that's actually, kind of a whole nother level of need. And so if you come back and ask me in a year or two, when we've got some of this stuff that we're doing right now in our lab, we'll have hopefully data that we can start being more accurate in our speculation. But right now, I think it's a little bit premature.
Right. Okay. Well, I want to thank you, Dr. Goldhamer, for your time. I'm going to provide a link to your website and as well as to fasting.org. And I just have one question because I heard that TrueNorth is booked up. Like, can anybody get an appointment, or are you booked up for a while?
Well, we do book ahead quite a bit. We have a relatively low price point because we are a nonprofit organization, so we have an affordable price point. People spend $149 a night for a private room, share bath, and all of the care that we, provide as part of our program. So it's actually less, for example, than the hotels in town or something like that. So that tends to mean that we have more demand for services than maybe some of the more expensive, health resorty type of places. So you do have to plan ahead a little bit. However, we have a service that might be of interest to your viewers at no cost to your viewer. If they will go onto our website at health-promoting.com and complete the registration forms, we provide a phone consultative service to determine whether maybe they're a good candidate for fasting, or give them advice, or refer them perhaps to a place closer to them. If they can't get in quickly enough to us, we have doctors that we've trained that are operating places around the country that we can refer them to. So, and that's a no-cost kind of a situation where we'll kind of do a overview of their situation, try to give them the best advice we can. They do that just by contacting us through the registration process. So, even if we can't get you in, maybe we can send you to some place that can do a credible job of helping you if that's necessary.
That's a great service. Thank you, Dr. Goldhamer, for your time. And I will look forward to your future studies.